Hi, good morning. My name is Rebecca and I'm going to be your nurse today. How are you?
I'm doing good.
Good. Now can I get you to verify your name?
Dora Guerra,
Alrighty, Miss Dora. And how old are you?
52.
Okay. So today you are in for a general survey, so it's going to be an assessment of your head and neck. Is that okay?
Sure.
Alrighty, Miss Dora. So I'm going to begin by asking you just a few questions. I've already asked you your name and age. Do you know who the president is?
Trump.
Okay. Do you know who the former president is?
Biden.
Okay. Do you know what day of the week it is?
Monday.
Okay. Very good. Now, would you say, do you happen to have access to 3 meals a day?
I do.
Okay, very good. So your BMI, which is your body mass index, is appropriate for your height and weight. Okay, so that is very good. I noticed as you were walking in, your mobility was smooth and straight. I didn't notice any use of a cane or walker. Do you use any of those?
No.
Okay. And I also did not notice any physical deformities. Do you have any of those?
No.
Very good. Alrighty, as far as your posture, it is nice and straight. Your clothing is nice and clean, and it does show that you have good personal hygiene, okay? Now, is English your primary language?
It is.
Very good. And what about your mood? Would you say you're happy today?
Sure.
Okay, good. And is that a normal for you to be happy?
Yes.
Okay, very good. Alright, Ms. Doris, so we're going to go ahead and move on to the assessment part. I'm just going to clean my hands real quick. Okay. And I just want to let you know, again, like if you have any pain or feel uncomfortable at any time, just let me know, okay?
Okay.
Alrighty, so I'm going to begin by assessing your cranium, which is your head, okay? So I'm just going to be looking for any lumps, bumps, or bruises, okay? I'm going to look at the shape of it. Your head is round and symmetrical. I'm going to be looking at your scalp. And again, I'm still looking for lumps, bumps, or any bruises. I don't see any. I'm going to be looking at your scalp for any redness, flakiness, or dandruff. I do not see any. Your hair is dark brown, thin, and evenly distributed. Alright, Ms. Dora. Okay, so I'm just going to press on your head, okay? Do you feel any tenderness at all?
No.
Okay, very good. Alright, Ms. Dora, so from there I'm going to go ahead and move down to your face. I'm going to start off with your eyes, okay?
Mm-hmm.
So your eyes are round and symmetrical. Looking at your eyebrows. Go ahead and close your eyes for me. Your eyelids, your eyelashes, everything looks symmetrical. Go ahead and open them. I'm looking for any redness, swelling, or discharge. I do not see anything. Okay, Miss Dora, I do have a pen light here. I'm going to get you to just look straight at me. I'm going to shine some light in your eyes, okay?
Okay.
Right, very good. Okay, so I'm going to get you to look at my pen light, and then look at the wall behind me,
Okay.
and then the pen light one more time. Very good. So, Ms. Dora, your eyes are, they're round, they're equal, they're reactive to light and accommodation, so that is good, okay? Alright, so then I'm going to begin by pressing on your sinuses, okay? So these are your frontal sinuses, okay? Your maxillary sinuses just right here, be a tad bit below your cheekbone. Do you have any tenderness?
No.
Okay, very good. Alright, Ms. Dora, I'm going to be looking at your nose. Your nose is symmetrical. I do not see any redness, swelling, or drainage, or discharge. Very good. Alrighty, I'm going to move on to your ears. I'm just checking to see if I see any redness, swelling, or discharge. I do not see any. Do you happen to have any tenderness when I push on your ears?
No.
Okay. Alrighty, from there I'm going to go ahead and move on to your lips. So your lips are pink and moist. They're symmetrical. Okay. From there I'm going to move down to your neck. So on your neck I'm just looking for any lumps, bumps, or bruises or visible pulsations. I do not see any. I'm going to be checking. Go ahead and raise your head just a little bit. I'm going to be looking at your trachea. It's nice and midline. Very good. Go ahead and relax. Alrighty, ma'am. And then now I'm going to begin by looking at your lymph nodes, okay? I'm just going to be touching your lymph nodes, and as I go, I'm just going to roll my fingers over them, okay?
Okay.
And then again, if you have any tenderness, let me know. Okay, I'm going to be calling them out as I go. So here we have the pre-auriculars, right here in front of your ears.
Okay.
Your post-auriculars that are right here behind your ears. Okay, very good. Okay, and then here in the back, we're gonna have your we'll get you to tilt your head to the side because you're all occipital. Okay. Alrighty. Okay. Alright, Miss Dora. So right here is your just the digastric lymph nodes. It's gonna be what you would consider your tonsils. Mm-hmm. Okay. Your submandibular, right here underneath your chin. Okay. And your submental here in the middle. Mm-hmm. Okay. Alrighty. From there, we're gonna move down your neck. I'm gonna start with the posterior cervical. Okay, here in the back. Okay, your superficial cervical here on the side. Okay, and your deep cervical here in the front. Alrighty, Miss Dora. And can I get you to just shrug your shoulders? Okay, I'm just going to be assessing your supraclavicular lymph nodes. Any tenderness? Mm-hmm. Okay, so you can go ahead and relax. Alrighty, Miss Dora, so I'm going to go behind you, okay? I'm going to be assessing your thyroid. I'm just going to place my finger here. I'm going to be checking the back, so go ahead and lean your head to the right. Go ahead and swallow. Very good. You can go ahead and lean your head to the left. Go ahead and swallow. Very good. Alrighty, you can relax. Alrighty, did you happen to have any tenderness?
No.
Alrighty, Ms. Dora. Do you have any questions for me?
No, I don't.
Okay, well that concludes our general survey for today, and I just want to thank you for your time, okay? I appreciate it.
Thank you.
Alright, you have a good day.
You too.
Okay, so I'm going to begin by giving my verbal report over my general survey. My patient is AAAO times 3, consumes a regular diet that consists of meats, fruits, and vegetables. Her BMI is 24. That indicates a healthy range. Her posture was erect. Her gait was smooth and steady. She describes her mood for today as happy and indicates this is normal for her. Her speech is clear and articulate. Her English is her primary language. She was dressed appropriately for the weather, and her clothing was nice and clean and free of body odors. As far as my assessment, I started off by assessing her cranium. Her cranium is smooth and non-tender. Her scalp was intact with no visible redness or flakiness. Her hair was thin, dark brown with evenly distributed. Her eyes were symmetrical with no redness, swelling, or discharge noted per left. Her nose was symmetrical with no redness, swelling, or drainage discharge noted. Her sinuses were non-tender. Her ears were symmetrical with no swelling, redness, or drainage noted. Her lips were symmetrical. They were pink, they were moist, no cracks or lesions present, slight droopiness noted. As far as her neck, it was symmetrical with no visible pulsations. Her trachea was nice and midline. Her lymph nodes were palpable and non-tender, and her thyroids were palpable and non-tender. And this concludes my verbal report. Thank you.